Good afternoon, my name is Gabriel Adorno, and recently I've been wondering, what are the causes of kleptomania? Have you ever had the urge or curiosity to steal something you really want? Because if it was for me, I would have made up an entire plan, Money Heist style, for all my Netflix fans out there, to steal the whole Apple brand merchandise. Don't worry, I'm kidding. But why are they so expensive? Anyways, did you know that there are people who actually can't contain the urge to steal for no reason, and that it is considered a mental health disorder called kleptomania? Because I did not. Nevertheless, I decided to do some research on the topic, and the more I learned and watched videos about it, I realized the lack of education surrounding this rare condition. Furthermore, the lack of empathy and sympathy for the individuals who suffer this disorder. This way, I decided to educate myself to learn the importance of identifying these groups of people and how to help them. For this reason, today I will inform my fellow peers about the way we can recognize kleptomanic's symptoms and how it can be successfully treated through medication or the help of behavioral therapy with a licensed professional. When I was little, I used to enjoy the movie Edward Scissorhands by Tim Burton, and I remember being so fascinated by the main characters played by Johnny Depp and Winona Ryder because they had good chemistry. Furthermore, my mother proceeded to tell me that Ryder had been arrested for stealing $5,000 worth of designer clothes. I was in shock after hearing this because why would someone that has millions on their bank account and a successful acting career would feel the need to steal? It turns out that according to the trial held on November 6, 2002, the judge determined that the incident involving Winona had to do something with a mental disorder called kleptomania. You see, though this topic may not be as discussed as often as it should, there is people who suffer from this delicate mental disorder that affects the way they live and coexist with others around them. These are referred to as kleptomaniacs. But you may be wondering, what is this disorder and how can I identify it? Well, according to the Diagnostic and Statistical Manual of Mental Disorders, kleptomania is an impulse control disorder characterized by the inability to resist the impulse to steal. Often the objects that are stolen are not needed and have no significant monetary value. Furthermore, kleptomania is a rare condition and is only diagnosed in 0.3 to 0.6% of the population, as you can see on the graph on your right, and there are 3 females for every 1 male diagnosed. Some symptoms may include inability to resist powerful urges to steal items that you don't need, feeling increased tension, anxiety, or arousal leading up to the theft, feeling pleasure, relief, or gratification while stealing, feeling terrible guilt, remorse, self-loathing, shame, or fear of arrest after the theft, return of the urges, and a repetition of the kleptomania cycle. Moreover, people with kleptomania typically exhibit these features. Unlike typical shoplifters, people with kleptomania don't compulsively steal for personal gain on a dare for revenge of utter rebellion. They steal simply because the urge is so powerful that they can't resist it. They experience severe anxiety attacks and addictions. Episodes of kleptomania generally occur spontaneously, usually without planning and without help or corroboration for another person. Most people with kleptomania steal from public places such as stores, supermarkets. Some may steal from friends or acquaintances such as at a party. Often, the stolen items have no value to the person with kleptomania, and the person can afford to buy them. The stolen items are usually stashed away, never to be used. Items may also be donated. Urges to steal may come and go, or may occur with greater or lesser intensity over the course of time. Consequently, having a difficult mental disorder like this one can bring many challenges in your life and your loved ones. Notably, in order to help an individual who may have this condition, you must seek professional help, even if it's hard for them to accept the offer. According to an article by the major clinic, many people who have kleptomania don't want to get treatment because they are afraid they'll be arrested or jailed, which is something that happens often due to the many thefts, and instead of trying to get a mental evaluation or a diagnosis, they just simply get arrested without knowing they ever had the disorder, resulting in a common confusion between kleptomania and stealing. So what's the difference among the two? So the difference between people with kleptomania and the ones who steal or shoplift is that kleptomaniacs don't steal to feel satisfied or on purpose. They do it because the urge is so strong that it takes over them physically and mentally. In addition, the causes of kleptomania are unknown. Several theories suggest that the changes in the brain can be the root of it. Furthermore, to understand and treat individuals affected by this, the condition is linked to problems with a naturally occurring brain chemical called serotonin that helps regulate moods and emotions, addictive disorders, and the brain's opioid system. So, how can we help? Well, according to the same article by the Diagnostic and Statistical Manual of Mental Disorders, kleptomania often responds best to a combination of cognitive behavioral therapy with an emphasis on recognizing and coping with the urges related to the condition and the use of psychopharmacology. In other words, contacting a mental health professional to help you get through these urges and addictions. This way, lithium anti-epileptics, opioid antagonists have proven effective in controlling the urge to steal, and antidepressants may ease the common feelings of shame and self-loathing that accompany this disorder. This way, if you suspect a close friend or a family member may have kleptomania, gently raise your concerns with your loved one. Always keep in mind that this disorder is a mental health condition, not a character flaw. So approach the person without blame or accusation. Remember to emphasize these points. You're concerned because you care about your loved one's health and well-being. You're worried about the risk of compulsive stealing, such as being arrested, losing a job, or damaging a valued relationship. You understand that with kleptomania, the urge to steal may be too strong to resist just by putting your mind to it. Treatments are available that may help minimize the urge to steal and live without addiction and shame. If you or a loved one need help preparing for this conversation, talk with your doctor. Instead of being judged like others that are thieves with a motive or for pleasure. Finally, getting educated on not only this topic but any mental health disorder is crucial nowadays. This is because over the last few years, cases of fatalities involving these conditions have increased. One example for this can be the Winona Ryder's case I mentioned in the beginning. Not only did the press and the public destroy her at the time, but she lost many opportunities that benefited her career. Evidently, this is a result of the lack of education in untreated individuals who don't receive help because they are told that they are putting on a show or it's just a phase. Thank you for listening, and remember to make sure that your loved ones are okay. Bye.